Hi, I'm Suzanne McCarroll, and I am currently in Santa Barbara, California, and I am a longtime survivor of both an auto and allo transplant. I've been in the healthcare system now for more than a decade. It's been kind of a long road, but I must tell you that I found the managing of insurance claims and medications and compound medications more difficult than the transplant itself. I've often said that having cancer and managing insurance is a full-time job. And I feel like that's kind of a joke. It sounds like kind of a joke, but it really is not. I spend just ridiculous amounts of time on the telephone and online trying to get insurance claims paid and the codes right from the doctor and etc. It's highly frustrating, and I can't imagine. I was working as a TV reporter for CBS News, so my job was researching online and getting information and condensing it down into 2-minute segments for the news. So in theory, I should be a pretty good researcher, but I don't know. My talents have not translated well to managing my insurance claims. I've had to retire early, or I don't know, retire is the right word because I was much too young, but I did have to leave my profession because of post-transplant. I was immune compromised, which as a television reporter, you're out mingling and traveling and mingling with the public and interviewing COVID patients. And so obviously that was not the job for me. Not to mention one of the previous speakers eloquently put the appearance changes that you undergo. And obviously being on camera, you can't have prednisone puffy cheeks and red eyes, and I've had graft versus host in my mouth. So sometimes when I talk, I sound like I've been drinking, like at 7 a.m. in the morning. So I did have to kind of slide out of my profession, which I dearly loved, and transition into something else. One of the interns, I had a transplant both at Dana-Farber and in Denver. And one of the residents, I guess he was a resident, came into my room and was chatting with me after my transplant and asked what I had done, what I did for a living. And I said I was a network reporter for CBS News. And as he said, oh, and didn't say much. And then as he left, he said to his friend, I guess he thought I couldn't hear him, do you think she really was a television reporter? Or do you think the medication has made her a little confused, because I can't imagine she was ever on TV, which was so accurate, but it was funny to hear someone say that. I think that I have done well in terms of enjoying my life and really making the best of things. And I think what has helped me is obviously family and friends, but also keeping a sense of humor, because the crazy predicaments you get into and questions you're asked and things you have to do. And if you don't have a sense of humor going through all this, I don't know how you would survive. So that's my story. It's probably shorter than most because I'm used to TV news, which is 2 minutes or less. So I know somewhere there's a clock telling me if I'm going over 10 minutes, but I think I'm vastly under it. But I'm anxious and willing to answer any questions when it comes up for panel discussions and question time. So thank you very much for having me.